So, precordial leads. These are the leads you stick on the chest. I think you all know that. I hope. All right. So,
Ow, thank you. It hurt.
V1 and V2 are looking at the septum of the heart. Okay. V3 and 4 are the anterior wall of the heart, so the front. Okay. And 5 and 6 are looking at the lateral wall, so the side. Now, one way that you can remember that, 2, 3, and AVF are looking at the inferior wall, so some people remember, stole my damn marker. ISAL. So, inferior, septal, anterior, lateral. Okay, so that might help you remember what goes to what. All right. So, this is the proper placement. What do you think happens if you don't put it in the right place?
You got the wrong picture.
You get the wrong picture, right? Because you're taking a snapshot and a picture in time of the heart, but if it's not in the right place, then you're not going to get the right picture. So, don't put them too high, don't put them too low. Make sure that you're not putting it on breast tissue. You want them on the bone, so it's got to go underneath, right? So how do we properly lift up a female's breasts? Back of the hand, okay? If at all possible, have them lifted up themselves. And has anybody experienced the things falling out from underneath?
Mm-hmm.
Yes, it's always a surprise, right? Sometimes things come out, okay? So just be prepared for that. Always wear your gloves, okay? But if you can get them to lift their own breast, great. If not, you ask them for permission and then use the back of your hand, okay? If a female is available, obviously that would be better. Some people care, some people don't. All right? All right. Does everybody know where they go? We're all good with that? On the chest. Oh, good. All right. So, now, the thing to remember, each monitor is different, okay, as to how they work. And for the most part, we have our physio monitor, our life packs, and our Zolts pre-hospital, okay? There are some Philips out there, and there's the fancy Philips one that's super lightweight, detaches from the defibrillator, it's kind of cool. But, when you're looking at a 4-lead, it doesn't apply the same filters as it does for the 12-lead. Okay, so that's why sometimes, and this happens especially more so on a physio, I've seen it, you'll look at their 4-lead and be like, holy crap, look at leads 2 and 3. I think they're having a STEMI. And then you do the 12-lead and there's nothing there. And you're like, So why that happens is because it's the electronics is applying a filter to the 12-lead to block out like any extra noise and things like that. Okay. Back in the old days, cell phones used to interfere with the EKG. Doesn't anymore, luckily. But, cell phones used to be larger blocks of things. It probably gave off lots of radiation or whatever. But it,
The biofilm.
yeah. And it would cause something called 60-cycle interference, which we don't see it much anymore. So that's a good thing. Because you look at it and be like, what is going on there? Okay. All right. So, make sure you know what the requirements are of the hospital that you're going to, especially if you think your patient's having a STEMI and needs to go to the cath lab. Because Vassar, for instance, will not accept any 12 leads without the patient's full name on them and age to go to the cath lab. They will wait till you get there and do their own. Okay, so if you send one without their name on it, they're not going to do anything about it. Right? So you got to know what they will do, because I hate the Zols in terms of putting names in because it takes forever. Okay, it's like 1980s technology for putting somebody's name in there on the strip. The life packs are a bit faster. Right? But anyway, you want to have their name on it. The life packs will spit out a new 12 lead if it changes. The Zols do not. Okay? It's a good idea to take numerous 12 leads if your patient is actively having chest pain, because things change. In 10 minutes, you could have a completely different 12 lead. Okay? So you should do